Macular degeneration is a condition in which there occurs in later life, and there are two sorts. There's the dry form, where you get gradual and slow loss of vision, and there's the wet form, where you have new blood vessels growing underneath the retina, which produces a more acute form of the condition. And in that variant, there can be rapid onset of blurring of vision, of distortion of vision. One of the problems is that patients may not notice that this has occurred because we walk around with both eyes open, that it only happens that we happen to close one eye and then realise that the vision has dropped in that eye. When you do develop a wet macular degeneration, while it's not an ophthalmological emergency, it needs to be dealt with quickly. And we would like patients to be seen within 5 to 7 days for assessment. Now, the assessment consists of measuring the vision, carrying out retinal imaging, so we do special photography looking at the different layers of the retina, and possibly with fluorescein angiography, where a dye is injected into a vein and photographed as it flows through the retina and picks out the new blood vessels. The condition is now treatable. For many years it wasn't possible. Then we had laser photocoagulation, but now there is treatment with injections of a drug which kills off the blood vessels, and these injections are administered into the back of the eye. These injections have been shown to be very effective, and I think it divides into three groups: those that will improve with the injections, those that remain stable, and then another third whom whatever you do, the disease will progress and there'll be a reduction in vision. That's a very simplistic way of analysing it, and there have been very many studies which have been done comparing the different forms of treatment and the dosing. The injections need to be given generally on a monthly basis for 3 months, and then there are different treatment protocols as to whether you repeat the injections 2 monthly intervals, or it's done on a process called treat and extend, where it depends on the symptoms and the response to the initial therapy.